Good morning, everyone. We will be starting with our program in a few minutes. Thank you. All right. Good morning, everyone. I hope everyone is as excited as I am for the 2021 ERDT conference. I am Lawrence Bello, an associate professor of chemical engineering and also an ERDT faculty advisor from De La Salle University, and I will be your host for this morning's session. Before anything else, I would like to welcome and acknowledge the presence of the following: the ERDT scholars, faculty advisors and alumni, ERDT steering committee members, and our invited participants, University of Baguio students, Association of Civil Engineering Technology Students of TUP Manila, PICE, Silliman University Student Chapter, Adamson University Electrical Engineering Student Society, as well as other guests. So in order to formally begin our morning session, I have the honor to introduce the current program leader of the ERDT. He is also the Dean of the College of Engineering of UP Diliman, the ever so energetic Professor Ferdinand Manigdig.
Department of Science and Technology Secretary Fortunato de la Peña, our guest speakers, the Senior Program Officer of World Bank Identification for Development, Dr. Jonathan Mark Skell, the Project Leader of Advancing Health Through Evidence-Assisted Decisions with Health Policy and System Research Program Telehealth Project, Dr. Portia Grace Fernandez Marcelo, the Project Leader of Upscale, Professor Louis Sison, the Founder and Chief Executive Officer of Pocketwork, Mr. Arnold Bagabaldo, Steering Committee members of the Engineering Research and Development for Technology from various agencies and industry headed by Undersecretary Renato Solidom and Director Josette Billo, Consortium University Project Leaders, officials from the Department of Science and Technology and its affiliated agencies, and stakeholders in engineering research and education in the Philippines, UP Diliman ERDT Project Leader and Associate Dean for Research, Professor Gerald Joe Denoga, our session moderator, Dr. Marnel Peradilla, Dr. Lawrence Bellio, guest, my warmest greetings. I would like to welcome everyone to this two-day 17th Engineering Research and Development for Technology Conference. Many thanks to the organizers of this important event, which is a marvelous way to bid 2021 farewell and to welcome another challenging year. What have we learned after 2 years of living with COVID-19? First, ours is a society so interconnected that a health-related concern can cause peril in our entire social system. And second, an interdisciplinary approach is necessary for proactively dealing with the pandemic and its effects on various sectors. That is, we had to get out of our comfort zones and maximize the strength of our various disciplines in innovating ideas that can help our nation adapt and recover. A health crisis of this proportion, which has bent different economies around the world and has taken millions of lives, can only be countered with an even more sophisticated approach. I'm sure we can expect more local and international conferences on engineering innovation and technology for recovery and resilience in the future. What makes this 17th ERDT conference unique from previous conferences is the exploration of new technologies that can turn the tide and place humanity at an advantage versus the pandemic. According to the World Health Organization, it is a possibility zone that COVID-19 could have normal circulations in particular populations and at highly predictable patterns. Whatever could happen, our best route is to be prepared with efficient technologies that can help our nation adapt and recover from the effects of the pandemic and to aim for their long-term usability. Although engineers and scientists can always assure the Filipino people that we would strive to fulfill our responsibilities, our optimism needs to be realistic as well. We need to do the nitty-gritty work in turning the tide and push harder because too much has already been lost and more is still at stake. While it is true that the virus does not discriminate, response and recovery mechanisms are based on incompatible social and economic conditions per country. We already had looming challenges in the country to begin with before the pandemic, including poverty, sustainable housing, unemployment, and efficient solid waste segregation, to name a few. When it landed on stage, COVID-19 pulled the ropes and turned these challenges into a crisis comparable to the effects of World War II. Manila may not have been bombed to shambles, but our economy was crippled nonetheless. COVID-19 urged us to a battle we are still fighting today. For that reason, the task to mitigate the effects of COVID-19 is urgent because we still need to win this battle. And in winning this, we need to aim for a better normal. As 70% of the 12 trillion pesos debt is driven by domestic debt, our economic recovery becomes essential. Recovering would mean stimulating the economy and creating jobs for millions of unemployed. We are facing a crucial period in our country, one that can be decisive enough to uplift the quality of life for millions of Filipinos. Our technological innovations can help create jobs and economic growth. They can create pioneer solutions that the government can also help develop for the sake of economic recovery. What we have learned from 2 years with the virus is the need to combine the strength of our respective institutions in looking for solutions that genuinely work for the greatest good. Seeing such effort to innovate and collaborate highly encourage engineering students to engage and apply in society what they have learned from our respectable institutions. Despite setbacks, missed opportunities, and reinvented dreams, our students will be able to seek new opportunities in demonstrating their brilliance in our evolving society and, of course, in never giving up on humanity. Similarly, this is a great opportunity for consortium members, affiliated agencies, and different stakeholders of the ERDT to develop new research and to expand the think tank of innovation while strengthening ties across various sectors. With or without the pandemic, our expertise is needed to create solutions and elevate the quality of life. However, the conditions today are accelerating our pace. This conference is designed to digest ideas and concepts and new technologies that could help our nation recover and advance. I would like to thank you all for attending the 70th ERDT conference. May this be a stride in gearing our nation towards a better and brighter future. Maraming salamat, mabuhay tayong lahat.
Maraming salamat, Dean Manigdeg, for graciously welcoming everyone to the morning session of the 17th ERDT Conference 2021. So, in order to give us what is in store for us in this morning session, it is my honor to introduce our session moderator for this morning. He is an associate professor at the College of Computer Studies and a research scientist at the Advanced Research Institute for Informatics, Computing, and Networking at De La Salle University. He also serves as the Assistant Dean for Research and Advanced Studies for the College of Computer Studies of DLSU. His research interests include computer networks, protocol design for communication and security, ad hoc and wireless sensor networks, programmable networks, and blockchain solutions design. So without further ado, let me welcome my colleague, Dr. Marnel Peradilla.
Right. Good morning, Dr. Lawrence. Yes. Welcome, everyone. Again, thank you for joining us for today's morning session. Again, my name is Marnel Peradilla, and today we will hear present from our 4 presenters, which focus on technology for different social application domains. So without further ado, I would like to introduce our first speaker for today. He will present accelerating vaccination deployment through digital IDs. He is a senior program officer of the World Bank Group's Identification for Development initiative, which helps countries realize the transformation potential of digital ID for better lives, societies, and economies. He's based in Singapore and supports country and regional projects investing on advising on digital ID projects with governments in different regions. So without further ado, I want to introduce to you our first speaker, Mr. Jonathan Marskel.
Hello, can you hear me?
Yes, Mr. Jonathan. Yeah.
Excellent. Let me share my screen.
Yes.
One second.
While Mr. Jonathan preparing for his slides, I would like to remind you that we will accept questions at the end of the four presentations. You may type your questions on the control panel, and we will collect these questions and try to read them all during the live discussion. Thank you.
Thank you so much, Manel. And let me start just by thanking the organizers for the opportunity to speak at the ERDT. It's a terrific honor for me. And secondly, to pass on best wishes for those affected by Typhoon Odette. Hopefully, the impact will not be as big as envisioned and that there can be a swift recovery. So as I mentioned, it's a pleasure to be with you and to present about how digital ID can be used to support vaccine delivery. So to briefly introduce my program, though, at the World Bank, Identification for Development, or ID4D, it's a cross-sectoral initiative of the World Bank. Currently, we're supporting more than 45 countries to implement digital ID systems. That's both financing and technical assistance. And in fact, I've had the honor to be involved in the Philippine National ID Project, PhilSys, since its inception in late 2017. And we've had a close collaboration with the Philippine Statistics Authority, the Department of ICT, NEDA, and other stakeholders. We also publish research, including a paper online on the role of digital ID in the delivery of vaccinations. Then in terms of the World Bank's response to the COVID-19 pandemic, this year we've made available $12 billion of financing to purchase vaccines, as well as tests and treatments. And whilst we're acquiring those goods, we're also working on building the capacity of countries on the delivery mechanisms, on the supply chain, etc., to orchestrate the delivery. And so this has required a lot of work across different teams within the institution, not just health, but digital development, governance, financial sector, etc. This is a framework that we use to analyze the role of digital in the COVID-19 vaccine delivery. On the top layer, you've got the solutions, and there's different types. There's open source solutions, such as DHIS2 or DIVOC, for example. You've got those that have been developed within the country, like VIMS. Then you have proprietary closed source solutions. And depending on the maturity of the country, these may be a cloud or as a service products or installed in national data centers and cloud services. Then you have the enablers, so the health information systems that already exist, particularly for electronic medical records. You have the registries and digital ID systems. And we've combined these two deliberately because these can be civil registries, for example, all kinds of systems that are used to identify the beneficiaries or the patients. You've got connectivity and digital infrastructure. This is obviously a challenge in the Philippines, where there's parts of the country where internet may not be as fast nor reliable as what it could be to support digital rollout, and then the skills of the health workers to use that. Finally, the safeguards for data protection and privacy, cybersecurity, and digital inclusion. I'm not going to go through this slide in great depth, but this is also the life cycle. So broadly speaking, there's 4 stages: the planning and management, supply and distribution, delivery, and the post-vaccination, which includes monitoring of adverse events and the certification of the vaccine delivery. So what is digital ID? I thought it'd be important to add this slide because there can be some misunderstandings of what is meant. And you'll see a Venn diagram on the left here. So the orange part are official ID systems. In the Philippines, actually, there's many of these. You've got the birth certificates, the UMID, postal ID, driving license, passport, etc. All those things that are considered a valid ID. Then the top blue part, digital. These are all kinds of ID systems that use digital technologies. And this can include unofficial systems like Facebook, for example, Twitter, LinkedIn, etc. And so it's the confluence of these two which creates digital ID. So what kind of ID systems that can be used for online transactions and that use digital technologies? So how can this help with vaccine delivery? There's 4 elements that we've identified. First is to identify the beneficiaries proactively. This means prioritization, for example, by age. We know several countries who have used their national ID system as the first filter to identify the senior citizens who would be priority beneficiaries. Of course, there's other groups like health workers where they're identified through various registries or by the employers. But this basic demographic filter has been useful in some contexts. Then there's other characteristics that you might use for identifying beneficiaries, such as geography or other characteristics that may be included in the national ID system. Then when someone visits the Bakuna Center, the vaccination center, you want to verify their identity properly, and you want to ensure that the data that is being collected and encoded is accurate, right? Which we know is a challenge in many countries, is that paper forms are filled out by the beneficiary or the health worker, and then it's taken to somewhere else, those forms, and someone at the back office is encoding this information. Of course, there can be issues with illegibility, data entry errors, etc. And this can cause all kinds of problems when you're, for example, trying to monitor coverage or to provide digital vaccine certificates. And so having a digital ID system allows you to automate these processes of registration and verification so that all the data is collected in a machine readable format, and therefore you remove the opportunity for human errors. Similarly, a number of countries have developed websites that allow citizens to book their appointments online and to verify their identity then and there during that booking process using their digital ID. Again, this saves some steps at the Bakuna Center. It also prevents people from making multiple appointments at multiple centers on multiple days, etc. So this has been helpful from that perspective. Then you've got certification. Now, a vaccine certificate is not an ID. Right? It just proves whether someone has been vaccinated and the circumstances or details of that vaccination. Nonetheless, digital ID can help in this process by linking the vaccination record with the right individual and allowing them to obtain that certificate. So currently, for example, in the Philippines, you have VaxCert-PH. And in order to obtain that online, because currently there's no national ID yet that's fully covering the population and fully operational. In order to obtain your VaxCert-PH, you need to put in your demographic information and the exact details of your first and second vaccination, or the only one if it's Johnson & Johnson. Now, there have been some issues with data quality, and so this has been a challenge. In another country where I'm working, where they have a national ID, someone just has to put in their national ID number. They verify themselves in a very simple way, such as your date of birth, and then they can download the vaccine certificate. There's still data quality issues on the certificate, but at least the person has the certificate, so they can do the things that they need to do in accessing services, etc. Then interoperability between records. So when you have different information systems, the LGU is collecting information, putting it into, uploading it to DOH, and then it gets shared in various data warehouses and databases, etc. Again, when you have these issues of data quality, when there's issues with the name matching or whatever, this creates challenges with the interoperability and exchange of information. Whereas again, if there's a digital national ID involved, you can use that ID number, and that becomes persistent across all the systems and facilitating a very seamless flow of information between these. Some examples. So in Indonesia, at the start of their rollout, you could put in your national ID number and check if you're on a priority list. And this was a national government website. In Denmark, I mentioned earlier, people verify themselves online before making an appointment. But importantly, this is not the only way people can make appointments. They can still phone up and make appointments in traditional ways, but some automation facilitates a more efficient use of resources. Then in India, they've linked their vaccine certificate to the digital national ID known as Aadhaar, and this allows, as I mentioned earlier, citizens to easily obtain their vaccine certificate through a mobile app. But a very important caveat, and if there's anything that you take away from my presentation, I hope this is the one thing. That is, while digital ID systems can help in the delivery of vaccine programs, as I've described, it should never be a requirement in order to access vaccination. There should always be alternative mechanisms for people who do not have an ID, who do not know how to use an ID, or when the systems fail, for example, when there's no connectivity. So there should always be manual and analog backup processes in case digital systems fail or that the digital systems do not work for people. So digital ID should not be a system that excludes anyone from accessing vaccination. When you're designing ID systems, it's important to bear in mind good practices, and a group of international organizations, including the World Bank, have developed these 10 principles on identification for sustainable development. You can see them here. I'm not going to read them out, but they touch on the themes of inclusion, design, and governance. And I'm pleased to say that the PhilSys is actually has adopted these same principles. They've registered 50 million people so far, so half the population in country, which is a phenomenal achievement when you consider the current circumstances that we're in. People are now starting to receive their IDs, and I think this is a very exciting time because the digital ID system of the Philippines it's going to be world leading, and it's going to be a platform that's going to support the delivery not just of vaccinations in the future, but response to natural disasters and the growth of the Philippines' digital economy more generally. Thank you so much.
Thank you very much, Mr. Jonathan Marskel. Again, if you have questions related to his presentation, please post that on our Q&A, and we will discuss that during our panel discussion. So moving on our next speaker, Dr. Portia Fernandez Marcelo. She will present e-health innovations for accessible and quality healthcare for all. Our speaker finished her Doctor of Medicine at the University of the Philippines, Manila in 1993 and completed her master's in public health and at Johns Hopkins School of Hygiene and Public Health in 2001. At present, she is an associate professor in community medicine and social medicine and global health at the College of Medicine at the Philippine General Hospital, UP Manila. She's also a director of the NTHC, or the National Telehealth Center, under the National Institute of Health in UP Manila. So let's welcome Dr. Portia Fernandez Marcelo.
Yes.
Hello, Doc.
Yes, good morning. I will ask Anne to put on my slides. And yeah, let me correct our moderator. I've been promoted. I'm now professor, and I'm no longer director of the National Telehealth Center since 2017. So there was new information. But nevertheless, thank you very much to the ERDT for the invitation today. And I appreciate that. Well, there is a health person in me invited to do this important session, precisely because, as Dean Manigdig emphasized, it finally demonstrated that the health sector alone is not the solution, or can put in the solution for this global pandemic. But every day there is a pandemic on health, or there is an epidemic in health. And, it only demonstrates that the health sector alone need the rest of you, including the engineering team, the innovation community, to address a lot of the problems. I also thank the presentation, Mr. Marskill, for presenting that. The National Telehealth Center was part of the ones campaigning for standards, and the unique identifier remains to be an elusive goal for the Philippines. I know that we are beginning, but we will reap the benefits later on. So this is my presentation. Next slide, please. Thank you, Anne, for facilitating this. Can I move this? Okay, so this is my outline. I emphasize the first two, and if we have time, there is actually a video that will synthesize things. Next slide, please. Yes. So let me, sorry about this. Next slide. Yes. So let me present about 4 concepts so that we level off on, discussing health and the pandemic and how engineering can help us in general. Next slide, please. So health is defined by the World Health Organization as a state of complete physical, mental, and social well-being. And in fact, if you check the dictionary, you will see the etymology that health is actually about wholeness. And the WHO was even more a fundamental human right. And with a birth certificate, with a national ID, the rights begin to be more clear, and the entitlements become more clear, including health. And in this day and the age of the Christmas season, health and salvation is also part of the definition. So it really just says that physical, mental, and even psychosocial well-being is integral when you talk about health. Next slide. Yeah. And as early as 1978, next slide, please. The World Health Assembly declared that there is inequality in health, and it is not acceptable to anyone. So politically, socially, and economically, this is unacceptable. And therefore, we should be working to eradicate this inequality in health. Hence, we are looking into science and technology and innovation to change and restore the sense of wholeness and health to each and everyone. Next slide, please. Okay. However, when you talk about inequities in health, I present to you the Philippine Statistics Authority finding in 2019 that 48% of Filipinos still pay for healthcare out of pocket. And we have a very weak third-party payer system, the insurance system, such that the poor are especially disadvantaged. Next slide. With the pandemic, next slide, please. With the pandemic, 26 million of the 110 million Filipinos are even pushed into poverty. And if you look into the burden of disease in the Filipinos, those who are worst affected with non-communicable diseases, hypertension, ischemic heart disease, stroke, diabetes, dialysis, and because of end-stage renal disease, infection, tuberculosis, and even COVID right now. And even injury, violence, especially, the deaths due to the extrajudicial killings. These are the poor. These are not the rich people. And when you talk about mental health and suicide, again, it is the poor people who are disproportionately affected because they don't have resources to access the better care that they need. Next slide. The Filipinos, if you would see, is 110 million. Next slide, please. And this slide actually emphasizes that it's not only the poor that we have to take care of, but also the young and the old Filipinos, because these are collectively what we call the vulnerable and the marginalized. And our health system is in fact organized this way. So there's tertiary care, secondary care, primary care, as well as wellness services. And our healthcare system, hello? And our healthcare system, in fact, should, when we think about health and medicine, we're essentially looking only up to 30-40% of the population. While they are important, we have to remember that majority of the Filipinos are actually well, and majority of the cases can actually be taken care of at home and in the community centers, the primary care health centers. And that is the focus of health sector reform. Okay, next slide, please. Next slide. Uh-oh. Next slide. Yes. So as I was saying, a lot of our interventions are on that 20% part. Can you go back to slides? Can I control my slides instead? Sorry about this. So as I was saying, when you talk about healthcare, this is only part of the solution when in fact targeting human behavior, the physical environment, and the socioeconomic factors will actually impact more and maintain and promote health, such that as a public health professional and as a doctor, it was more logical that e-health innovations focused on the primary care services to maintain wellness and health, so that the health system will not be overwhelmed. And this is what we saw with this COVID pandemic, how the doctors and the nurses were complaining globally, not only in the Philippines, how overwhelmed a poor healthcare system is already, is how overwhelmed. 2019, our Senate and our Congress finally passed the universal healthcare law. And here it talks about universality, which means all Filipinos should be covered by healthcare. Equity means preferential regard for the underserved and the unserved. And this is much consistent with the campaign of the university as a state university and the e-health innovations that we took on. So some examples will be that I will be discussing is really from my personal experience as project leader of various research. Our next speaker has been a longtime collaborator on the RxBox, Dr. Sison, and let me honor him with that work. And in 2014, NTHC's footprint would reach up to 389 towns in various research that we conducted, all about reaching the underserved. So, and sorry about this old slide, but even in 2 years of my work, we actually had a lot of money to ask from the national government for research alone. And that is when the government of Aquino came to fore, there was larger investment in research, and it has since increased. So for us in the academic community, let us take advantage of that precisely because it does find solutions for the current problems. This slide is busy, but it also shows you how we've nurtured a lot of our projects. At this time, in 2013, it was still in a small scale demonstration. So we were pushing for RxBox to grow towards large scale. And that was the vision for the 2016. So what it just emphasizes is that R&D goes through stages of maturity. And this is something new to me as a doctor, as a public health and policy professional. But I didn't, the idea of growing R&D work is something new to me at that time. So CHITS is the electronic medical record system. In 2010, we were already in 50 sites after 6 years. So it was very slow to spread. But by the year 2016, we were already in 320 sites. And CHITS would now be one of the first technologies licensed by the university to a small startup in e-health in the Philippines called Pivotal Peak. UNICEF also contributed, along with the local governments of Navotas City and Quezon City, in growing, in developing the research. And I think this is important to demonstrate that concept of interdisciplinary. So it's not only the academics, the technical people, it's really about governance. And we were happy to see local governments investing also in innovation in order to deliver better services. Navotas City invested in putting CHITS into M-CHITS, into mobile health. By that time, we have secured our position in the world as the global leader for using mobile phones. When actually, this idea also began in around 2008 with the UP Computer Science led by Dr. Festin, with his students working also with the UP College of Medicine, with Dr. Alvin Marcelo, in innovating a mobile version of CHITS. And also from the experience of the electronic medical record, we had to push this further and put together a dashboard so that we can use not only the electronic medical record for patient care, but also for public health systems. Okay, so with the support of UNICEF and the local government, we were able to show also that data in real time can actually be viewed by the public health managers. And it is in that experience that we started adding and integrating appliances into a system such as the RX box, linked into the CHIT, and then into telemedicine. Okay. So all of the R&D is important precisely because we were developing and encouraging more people to grow into this new discipline called e-health, or health informatics, medical informatics. Now it is called digital health. And the research lessons are needed for our campaign for policy. And we also found ourselves aligning with the open MRS communities, because this is the back end of and the open source community, so that we can use this for difficult to reach communities. The National Telehealth Center will later on be the organizing unit of what is the Asia eHealth Information Network. Again, lower middle income countries in the Asia Pacific, networking with also lower middle income countries and lower or economically poor countries, so that we can learn from each other. Because the lessons are really, are in our communities and what would be relevant technologies. Okay. So again, standards was something we covered at that time. In last decade, we were all beginning all of these interventions, and they were standalone systems, and therefore it brought for the standards, or it heightened the idea of standards. And we started campaigning for governance architecture. So all of these things we are seeing now because the National E-Health here, the Department of Health, the Department of Science and Technology for research, they also housed what is now the Department of ICT. So they were very strong in leading with the Department of Health.
Hello. Yes. Maybe we have some technical difficulties. Let's wait for Doc Marcelo. Ayan, I think she's here.
Oh, I'm back.
Yeah, she got disconnected.
I'm back.
Yes,
I'm back.
yes,
Sorry.
all right. We can hear you
Thank
clearly.
you.
Yeah, okay.
Yes. So I apologize for that. I'm in the university and I live in the University of Lee. And that is precisely why e-health cannot be health sector alone. Our Department of ICT should be doing its job very well in ensuring better connectivity if we are to push ICTs. I'm sure everybody agrees. I've already discussed a lot of innovations already in the country, and therefore I emphasize to consider e-health innovations again for Health for All as we emerge from the pandemic. Research collaborators from the engineering and the health and medical sector should agree on these principles of universality, equity, and accountability. And we can do that with good data and with good standard data. There has to be social solidarity, and our innovation should, in fact, have bias for the majority of the people and have social solidarity, especially for the disadvantaged and the poor. This is the vision for the Philippines in the future, that primary care providers will be stronger, as said, such that only a few will get and reach the apex hospital. We take care of the health and the healthy and the well, so that only a few will reach the hospitals and thus not overwhelming that. And telehealth solutions should, in fact, support all of these things. And you can see how telehealth can actually support also the education, not only of those who are in the cities, but doctors, nurses, medical technologists, who are serving the most marginalized communities nationwide. While we look into the clinical services, we should also look into telehealth solutions so that the people are very well knowledgeable about their healthcare. And ICTs are definitely supporting all of these things. And while we have several years of experience in e-health and innovating this one, what we found out is we only actually have 2 projects that is supportive of the entire concept of a universal healthcare and e-health. And I am happy to say that these projects were actually in collaboration with the project was with the Quezon City, where we in fact organized with the local government and the support of the UNICEF, the electronic service delivery network, where all the health facilities are actually online, and there is actually e-referral for mothers and their babies. And we are happy after the end of the research period, all the mothers who were referred through the system who are at risk for difficult delivery were actually safe and healthy. The second project is about universal newborn hearing screening, and we were able to demonstrate this, that even if the communities are separate, we can link them together with public and private to be potentially with hearing loss can be referred as soon as possible for definitive diagnosis and eventual care. So again, considerations for innovation post-COVID-19, and the emphasis is access and quality healthcare for all, would be the universal healthcare principles and the envision stronger health system that is enabled by electronic systems and telehealth. We have to consider that the innovation should hit these major problems of non-communicable diseases, infectious diseases, and even injury as we urbanize. And definitely, we talk about violence and self-harm. These are things that are getting to be close to be epidemic proportions already. And the idea that while we have productive age group, we still have a big sector that we have to support, the young and the old, as it is emerging. Okay, I will invite you to watch this video because while this is dated 2016, it actually encapsulates how the engineering and other sectors, as well as the medical and health sectors, actually work together for the RX box. And this was captured by the media in the show called Game Changer Philippines. So with that, thank you very much.
Thank you very much, Dr. Portia Grace Marcelo, for that wonderful presentation. So for our next speaker, he will present solving emerging market issues and introducing business innovations through technology startup. Our speaker, Luis Sison, Dr. Luis Sison is a professor at the Electrical and Electronics Engineering Institute of the University of the Philippines, Diliman. He is also a director of the UP System Technology Transfer and Business Development Office and the program leader of the Upscale Innovation Hub. He was Vice Chancellor for Research and Development of UP Diliman from 2006 to 2011, during which he established the Technology Transfer Office. He was awarded the Gawad Pangulo for Progressive Teaching and Learning by UP in 2015, and his course on innovation and technopreneurship got the Silver Award for Teaching Delivery at the 2016 Wharton QS Stars Reimagine Education Awards. He was also a visiting researcher at the at the University of California, Berkeley, as a Banato Fellow, and he holds an MS and PhD in Electrical Engineering degree from Purdue University, and his research interests are biomedical instrumentation and education technology. Let's welcome Professor Luis Sison.
Good morning, everyone. Thanks, Marnell. I hope my audio is okay.
Yes, we can hear you clearly.
Good morning again, Dean Ferdy, my fellow panelists, and colleagues in the academe and researchers as well, and other future innovators in the ERDT community. Magandang umaga po sa inyo lahat. When ERDT was founded in 2007, then DOS Secretary Estrella Alabastro approached us with one of our concerns. And that was, given the increased investment in R&D, how can we ensure that this increased investment translates to benefits for our local industries and for our local communities? So that challenge that was posed to us resulted in two innovations, and I'll walk through both of them. So the first is we started training our ERDT scholars in innovation and technopreneurship. So it started with the summer class, and now it's either continually taught in the summer or regularly in the semesters. And the second initiative, of which I'll talk more about, are the establishment of the technology business incubators. And so we established in UP Diliman, we established in 2010 the DOST UP Enterprise Center for Entrepreneurship. And we had our first batch of startups, which were also founded by ERDT scholars. Okay, and the support, our work and the support from DOST continued, and from the ERDT community continued. And in 2018, our scope of work was increased to support not just our campus, but also a bigger community. And again, with the additional help of DOST Preserved, DOST Preserved, we upscaled to the Upscale Innovation Hub. No? And in 2019, we were part of a cohort of TBIs that pursued international partnerships and benchmarking. And all of this hard work in the past decade culminated this year with the awarding of Upscale as a grand champion in the Philippine Startup Incubators Award. Right, and we have also partnered with an increasing number of institutions, including the UP ERDFI, to provide more support to our startups and student innovators as well. So I'm going to spend a bit more detail on what Upscale is and what we do. So in terms of technology transfer, we support two modes, either through incubating startups or spin-off companies, or in supporting industry academe collaboration and the subsequent technology licensing. So in our 1 decade in operation, we have incubated over 30 startups, 16 of which have graduated. Many are still currently going through our programs. Our startups have raised over 73 million in investments and generated over 100 million in revenue and created over 500 jobs. So our support program for startups is called Enterprise, and it's part of the Upscale umbrella. And we support startups even if they're not incorporated yet. So even if it's just at the R&D stage, but there's a promise of being able to support a market, then we can support your venture. So some of our ventures are listed here on this page, and among those ventures, I would like to highlight a few of them. So as you can see, we have a very diverse set of ventures. We have Green Ants, which is focused on sustainability. We have Cropital, which is supporting it's a fintech company supporting our farmers. So as edutech and training, we also have Experto. And then one of the older ventures that we supported, actually yung venture nila is based on the thesis sa undergraduate. So computer science to dalawan to from LaSalle, and they had an interesting, very exciting AI-based technology. No? We also have ventures in industrial applications. That's 1 watt. And pati social enterprise, meron po kami tinutulungan. That's Magway, and they're also helping us sustain our marine ecosystem through safe products. All right, safe health and beauty products. So I'd also highlight another set of ventures, and these are the 19 spin-offs that we have supported over the last decade, including the very first 2 that were co-founded by ERDT scholars. Okay, so you can also see the diversity of the startups that we support. Doc Portia mentioned, for example, Pivotal Peak, one of several health startups that we are supporting as well. And I'd also like to highlight that some of these ventures came from our innovation and technopreneurship class. Ventures like RetailGate and Domestics and Waste for Good. And we have also co-incubated some ventures with our partner institutions like Dwarm from FEU and Zeoskin from SLU. Okay. All right. And so we just launched our 11th batch. So we're starting the sessions already with them. And we'd expect the demo day, the demo day of the batch to be in the first or second quarter of 2022. So if you apply to Upscale, what kind of support can you expect to receive as a startup? So we have our esteemed panel of mentors, networking, not just for business development, but also for investment. So we help our startup secure grants and private sector investments. Most recently through our partnership with Accenture, and then we have a nice office. So we're working our way back from the quarantine and opening up slowly, but that resource is also available to our startups, and of course access to university expertise and facilities and equipment. And Upscale is part of a growing network of TBI supported not just by PSURD. So itong map na to, these are just the PSURD incubators. There's also incubators supported by Picard. So together and along with various private sector incubators, we have a thriving and growing ecosystem even in the middle of the a pandemic. Tuloy-tuloy po ang ating hanap buhay. And it's a very exciting time for us as well. There are a lot of opportunities, and as our economy recovers, we hope to be able to tap into the energy of the Philippine industry in our communities. So that's the incubation part. We also support industry academe collaborations. So we have partners in both in the food sector and in the real estate and construction sector, even in the energy sector, among in the utilities sector, among our growing set of partners. And we support not just collaborations with UP Diliman, but also with other campuses and universities as well. So I'd like to thank our hardworking team who have supported us over the years. So this is our current steering committee, led of course by Dean Ferdy and VC Xiao and our other deans in our steering committee. And then we have our esteemed senior partners. These provide very direct one-on-one support to our startups. Either they're successful technopreneurs in their own right or champions of industry. And of course, Upscale wouldn't be possible without our hardworking staff, Chris, Roger, Rizzy, Marge, Jace, Det, G, Mark, and Ariel. So do check us out if you're interested. If you think you have an interesting opportunity, you're excited about your R&D and want to take it to the next level, check us out on Facebook, Upscale Innovation Hub, or send us an email or check out our website. So we're looking forward to working with you and helping you out with your venture or with your R&D. So again, congratulations, Doc. Happy for the 17th ERDT conference. Thank you again for inviting me, and more power to ERDT.
Thank you very much, Dr. or Professor Luis Sison, for your presentation. unfortunately, our fourth speaker, Mr. Arnold Bagabaldo, cannot join us today. He is currently at Cebu, and we all know that the Visayas region uh, does not have a stable electricity supply and internet, so he cannot join us for presenting his topic. So, for that, we're now going to begin answering your questions. And as a reminder, you can still submit questions to the Q&A panel. Okay, and we will try to address your concerns or questions, okay, properly. All right. Oh, we have this immersive view. All right. All right. Hi. All right.
Classmate.
Okay. So, while waiting for questions, maybe I can start asking questions to Mr. Jonathan. Mr. Jonathan is here.
Yes, I'm here. Hello.
Yeah, I think he's the QR code. All right.
Digital talaga. No?
Yeah.
Exactly.
Digital.
All right. So, we understand the importance of centralized information infrastructure for delivering multiple government services. So, however, there are still portion of the population which are quite hesitant to these changes. No, how do you think how we will convince the citizens, no, the citizens to willingly participate to this digitization move?
It's a very good question and very relevant for the Philippines and countries at similar levels of development is this concept of trust. And it doesn't just mean trust in that these systems or technologies will not be misused, but also trust that anything that you do digitally will have the same legal effect as if you were doing it physically. I've been working in the Philippines for more than a decade, and it's quite telling, how many documents citizens have to get certified, signed, etc. A lot of red tape, which a lot of progress has been made to get rid of that. But the reality is that it's going to take it needs a comprehensive response. First, you need strong legal frameworks. And I think in the Philippines, generally speaking, this is in place. But the execution, and it requires a bit of a mindset change, starting with the civil servants they need to be allowed to take risks in how they deliver services and design systems, etc. And then that will trickle down to citizens having more confidence. And you can see there's a bunch of LGUs, particularly in NCR, that are more advanced with technology, and the citizens are experiencing the benefits of that. So once citizens see benefits of the use of digital technologies, whether it's reduced costs, reduced processing times, better quality of service delivery, I think they will see that. I can say in our work with the PhilSys, the national ID, there's been a lot of positive feedback on the experience at the registration centre. Of course, it's not perfect, but people have noticed that, setting the appointment, similar to DFA with the passports, that creates a better citizen experience, that the information that they provided through the website is preloaded, that they don't necessarily have to complete a physical form, those kind of things. Over time, you'll see more projects like this that will build the public's confidence in this. But fundamentally speaking, this issue of trust and particularly the security of information and safeguards against function creep and misuse is key. Thank you.
All right. Thank you for answering that, Mr. Jonathan. So I'd like to follow up. Question related naman to Dr. Marcelo. Do you think with this the evolution of this digitization, Dr. Marcelo, would you see that the information particularly electronic health information, okay, would be bind with this national ID system? And if yes, what will be the benefits of that sa health sector?
Yeah. I'd like to say the health sector is one of the first sectors who campaigned for standards and the national ID. And it's so logical. Remember, as you are born, the first record that you have is a baby record, a patient record. So it's in the health sector. And it's the same data that you will put into the electronic medical record. It's the same data that will be part of the birth certificate. In fact, our project with UNICEF demonstrated that. So yes, we agree that the national ID is among the standards that we have to have. And we're happy to see that now there is a PhilSys. So I'm also a CRVS professional and working with the Department of Health and the Philippine Statistics Authority. And we're happy to see that this is further along. And while this is not yet the numbers that are seen in patient records, eventually it will come to fore. Before the PhilSys came to be, it was the PhilHealth ID, which was in existence because it had the biggest database of Filipinos. So we were pushing for that while national government came to fore with the policy of a national ID. Over.
All right. Thank you for addressing that question. Again, we would like to hear your questions towards our speakers this morning. And for Professor Luis Sison, okay,
Yep.
some clarification with the upscale. Is the upscale open for public or anyone who would like to venture or to consult with their ideas?
Yeah. Well, we're very open. We're not exclusive to even our students or with or faculty, or even we're not even restricted to just academe co-founders. So we have a very diverse set of co-founders. As long as there's one question that we ask them when they apply.
Okay.
So one of our standard questions is, how do you think the university can help you with your venture? And we would like to understand how we can maximize the value that we can provide to them. So we do have a lot of resources and support that we can provide to our startups, and we look for that match. We're able to help you uniquely as a university, and through our distinct network, then that should be the start of a good working relationship.
All right. Thank you, Professor Sison. So do we receive organizers? Do we receive questions from the participants or attendees? All right. So from my co-panelists here, any questions to our speakers?
I have.
All right.
Okay. Dr. Sison, in terms of, can you please again emphasize how many health startups have we had?
Okay. Let me check my.
Sorry about that.
my Codigo. I don't have the number off the top of my head. So, health, we have Zeoskin, Adam, Meta, Pivotal Source.
Not more than 10.
Rebirth.
Not yet.
Yeah, konti pa lang. No? So we have about 5. Yeah.
Then did any of them, I'm sure a lot of them received national government monies. my point is that when I entered into R&D and innovation development, the idea of technology transfer was not clear to me as a public health doctor, as a community doctor. So in a way, I'm sure we've gone along learning from Alex, Max, and Hele. Is this now embedded into the grant process, this orientation and so on, so that we are fully aware, innovators in the health sector? I mean, the engineering sector are better, more familiar about startups, but that's not something known to us as public health doctors or as doctors in general, or the health professions. We are not necessarily aware that there is such a thing as tech transfer process.
Right.
So is there now?
It's not. Yes, it is. Admittedly, it's not a simple nor a straightforward process, and this is also work in progress for us. And one of the what we call the feeder activities that we are already in our third batch of is what we call the University Innovation Fellows, and before you even decide how you're going to take the next level, we provide coaching. So we currently have over a dozen different R&D projects in our current batch. Some of them, I think there's 3 of them that have plans to spin off, and the rest, the mode is to do industry licensing. So in the past couple of months, we've made some good progress. We've interviewed many potential industry partners, and we're working to define an initial a product or that they can already start piloting or doing some initial characterization for, and we hope that sets the stage for a more formal collaboration in the near future.
All right. So we have a question here for Dr. Marcelo and Dr. Sison. How can we increase the collaboration between the health and engineering sectors? And have you encountered challenges in the past with regard to interdisciplinary collaborations? Maybe we can start with Dr. Marcelo.
Yeah, ladies first. I will claim that. Well, the first thing was the university. So what encouraged the collaboration was the university policy. Louis would know more way back, and we're happy to see. So Louis and we worked since 2012. Into major projects, Hele as well as the RX box. And you will see that the 2 units of the university started working together more intensely. And then as we entered the COVID pandemic, this would now come to fore in what is called CBOL. And maybe we can talk about it more because there are now more researchers from the Diliman unit. So a variety of engineers, so computer science as well as the various disciplines of engineering, collaborating also with various medical sciences also. So many clinical specialists are collaborating together. So how can you encourage? Number one, it has to be a university policy. We are further into the idea of innovation already, to know that interdisciplinary work is necessary. It was never parang anything that we do is never in healthcare. It's never health sector collaboration alone. So as a public health doctor, I've campaigned for that ever since 1978. So bata pa ako. But as a young doctor, that's why I'm into community medicine. We knew that the social determinants made sense, and therefore if that is the problem, then it made sense that you have collaborators in those sectors so that we can address something that manifests in health but essentially affects our entire life. So it has to be a policy, and it has to be translated into management systems that are funded. Yeah. Those are things that I feel are critical elements of collaboration between sectors and between disciplines. Over.
All right. Thank you.
Yeah.
You want to have to follow up, Professor Luis?
Thanks, Portia. Yeah, thanks for the question also. So, I think we've gone a long way. So, in addition to our efforts in UP, and there's a lot of collaboration, especially in the past, year and so, between UP Manila and UP Diliman. Dr. Nilo Bugtay in LaSalle, with the support of PSA-HRD, is also doing a lot of good work in organizing the biomedical innovation and device community. And if I may add, just so Dr. Portia mentioned a couple of enabling factors. I'd like to add to the mindset and the process factor. And people have to get used to the innovators. Should think of collaboration as not a one-way street. It's not just from engineering to the clinicians, or even the other way around. The clinicians and then engineers do the design this. So it's what is productive is that there should be a cycle of discovery and learning on both sides, and of rapid iteration. And we have to be open to just listening to each other, and then continue incrementally learning incrementally together, and then keeping the venture moving forward. So that's one of the I think the big mindset adjustments that researchers who are new to these kinds of collaborations need to get used to, and that just starting with that openness and willingness to learn together. I think you'll go a long way with that.
Right. Thank you very much, Professor Louis. So I think Mr. JM is still here, right? Jonathan? Correct.
Yes, I am. Hello.
Okay. We have some question here. Based on the best practices recorded by the ID4D, how would you rate the Philippines' progress with its national ID system?
Sure. So I presented the 10 principles on identification for sustainable development, and the PSA has really used those to design the system over the past few years. And across all of those, the Philippines performs very well. It's a very inclusive system, including to enable Filipinos who do not have any breeder documents, such as indigenous persons, for example, or indigent persons, to register. Second of all, in terms of design, it's using open source, open APIs, a lot of international standards. And third, in terms of governance, there's the PhilSys Council, there's the involvement of the National Privacy Commission, etc. So the system performs very well against those metrics. And I think also it's worth, again, noting that this has been done in the most difficult of circumstances of a pandemic. That they've been able to register 50 million is quite an accomplishment so far. It hasn't been without challenges, and there are several challenges ahead, including to get adoption by various government agencies in the private sector. That's going to be a challenge as well moving forward. But overall, it's a very promising project.
Right. Thank you very much for that confirmation, Mr. Jonathan. Again, maybe we can have one more questions from the panelists or the attendees. All right. Dr. Marcelo, maybe we would like to inspire the ERDT scholars attending this conference. Is there any particular research gap that you want to address in health sector and technology. So maybe that would be their start for their a thesis topic or a project, or maybe probably a startup to apply with the upscale.
Again, I don't think like Louis, so the idea of startups, I am unclear, but I will talk about healthcare. And maybe the starting point will definitely be the burden of disease, what is affecting majority of the Filipinos. And, this, as we emerge from the pandemic, it remains to be a problem. So the work that has been done recently, I think that it's not only proof of concept, but you really need to establish that these are demonstrating good outcomes. Then it gets to be matured, and this is where the guidance of upscale and Dr. Louie and the likes, who know what innovation management is all about, so that it can actually sustain. No? So that's something what we need. So that area is not necessarily innovation per se, but it's really innovation management. So I feel that is important, so especially because COVID is so innovative. It changes all the time. We were hoping for a better 2022. Here comes Omicron, and we know it will get worse. So while we are enjoying the next few days, we are just taking advantage of the lack of diagnosis of Omicron yet. But it will happen, and I hope we can weather the storm. And more of our health professionals are leaving the country already, because the demand abroad is still there. No, it's so big because of the pandemic. Anyway, so it starts with that. So even health personnel management, how can innovation in science and technology improve and encourage health professionals to stay and serve in their country? Those are things that we have to look into. So it's not only what the disease conditions are, let's also talk about the wellness. Mothers and children, these are unfinished problems. Children remain to be at risk with this pandemic, and violence is there also because of their cyber presence. So, and that there are a lot of issues. So just knowing what we are sick of and what we are well of, these are things for you to think it out. And with that idea, I think it's important to talk to a colleague, a friend from another discipline, so that it will flourish. That I need Dr. Louie, an electronics engineer. Oh, I need a chemist. I need an agriculturist. So I think we have so many resources in the Philippines. That's why a lot of we are being exploited. I think we should take advantage also of our own resources, so that we become better partners. So 3 things: what we are well of, what we are sick of, and then what we are strong in. And the 4th part is talk to a friend, so that the idea flourishes and it gains ground. That's it.
All right. Thank you very much, Dr. Marcelo. Again, also thank you very much, Professor Louis Sison and Mr. Jonathan Markel for your presentations. I will now hand over the floor to our host, Dr. Lawrence Velo, to introduce our speaker for the closing message.
Thank you very much, Dr. Marnell. So thanks everyone for the dynamic discussion. But before we close the session, may I request everyone to please stay for our virtual photo ops later. So as we bring this morning's session to a close, allow me to introduce our closing speaker. He is currently the project leader of ERDT, UP Diliman. He is also the Associate Dean for Research of the College of Engineering of UP Diliman. Let us welcome the young and vibrant Dr. Gerald Jo Denoga. Dr. Denoga.
Good day to everyone. On behalf of the Engineering Research and Development for Technology Consortium, comprised of Ateneo de Manila University, Central Luzon State University, De La Salle University, Mapua University, Mindanao State University Iligan Institute of Technology, University of the Philippines Diliman, University of the Philippines Las Bañas, University of San Carlos, and the Department of Science and Technology through the Science Education Institute, we thank you once again for joining us this morning in the 17th ERDT conference. We hope you enjoyed the great talks about harnessing the latest technology and making them available and accessible to the community and the market. It is with this kind of innovative thinking that will allow us to prevail in the world war against a microscopic enemy. I would like to take this opportunity to thank our speakers for sharing their time and expertise. We hope we can invite you once again in future ERDT collaborations, as I am sure that there is more that we can learn from you. Speaking of more, while I am about to close this morning's plenary session, I would like to invite everyone back to this afternoon's session starting at 3 p.m., where we will have other exciting talks, this time about energy, transportation, and space technology. We will also be presenting on Wednesday afternoon, starting at 1 p.m., the latest research done by our ERDT scholars. We will have 5 breakout sessions showcasing their research on energy, environment and infrastructure, information and communications technology, manufacturing and machinery, and semiconductor materials and manufacturing. Kindly refer to our website and Facebook page for the virtual conference links. Once again, thank you everyone, and we bid you to stay safe and have a great day.
Thank you very much, Dr. Dinoga. So now, may I request everyone to please switch on their cameras for our virtual photo ops. May I ask the organizer to please give us a cue to smile. Because I'm not sure how many pages there are. We have 73 participants.
Hello, Dr. Bella. Yes, we're just waiting for the rest of the panel to open their cams, but there you go. We're doing immersive view now. To the members of the steering committee, please open your cameras for us to be able to have a photo with our speakers. All right, in the count of 3, everyone. 1, 2, 3. One more, please. 1, 2, 3. There you go. Thank you so much.
Thank you, everybody.
Thank you.
Thank you, everyone. Take care. Stay safe.
Again, may I invite everyone to join the afternoon plenary session and the oral presentations. So the details will be flashed on the screen during your logout period. So I am Lawrence Bello, and this concludes the morning plenary session of the 17th ERDT conference. So everyone stay safe. Thank you very much.
Thank you so much to our speakers. Thank you everyone for attending. We'll look forward to seeing you in our afternoon session.